So your headaches are over here?
Yep.
Does it hurt if I press over here?
A little bit.
Be prepared for your child to experience a lot of lumps and bumps during childhood.
She was doing some cartwheels and
I landed on my head in the grass.
You landed on your head on the grass.
Whether you think it's a soft tissue injury or a possible injury to the brain, you should have your child checked out by your pediatrician after a head bump. Pediatrician Ahmed Bayloni of Children's Physicians Medical Group says parents need to look for some telltale signs that could indicate something more serious than just surface swelling.
You can kind of get a big bump and a swollen little bump there that is kind of tender to touch. The other thing that can happen that we worry about is when you hit your head, you actually suffer damage to the brain, okay? Or the fluid around the brain where there's bleeding around the brain. So when your kid bumps their head, a couple things to look for are increased sleepiness. So more than just my child took a nap, but basically your child's sleeping and they just don't really have any interest in waking up. Vomiting is always a sign that there could be something going on in the brain, but if the pain is just, your child is complaining this is the worst pain ever and they're just inconsolable for a long period of time, then that's another sign that you want that child evaluated.
Head trauma is very common in young children, but concussions can be difficult to recognize in infants and toddlers because they may not be able to describe how they feel.
For infants or toddlers, you want to make sure that what was going on before the head bump is kind of still going on. So are they feeding well? Are they making wet diapers? Is there no new vomiting? Is their sleep the same?
Dr. Bayloni also recommends parents keep a close eye on their child for 24 hours because symptoms indicating an injury to the brain may be subtle and could take hours to appear.
So I think that probably what happened is, seems like since there's been headaches in there that there's a good chance she got a concussion from that fall. Basically a concussion, just in kind of layman's terms, is a bruise to the brain after a fall. And how we really treat it these days is with rest and then checking the symptoms again.
If your child doesn't have signs of a serious head injury and remains alert, all that's needed is an ice pack and some hugs.
So what I would do is, do ice packs to the place where your child hit their head and then just keep a close eye on them, There's no reason not to trust yourself as a parent. The person that knows your child best is you. And if you notice something that's out of the ordinary, then that's when you want to talk to your pediatrician.
To learn more about bumps to the head and other children's health topics, visit cpmgsandiego.com or call 877-276-4543.